Well, good morning. I'm Mark Clemens, MD Anderson Cancer Center, and I'm joined this morning with Fabio Santanelli from Sapienza University in Rome. And this morning, I'm pleased to discuss Fabio's newest paper, Breast Implant-Associated Anaplastic Large Cell Lymphoma, Review of Epidemiology and Prevalence Assessment in Europe. Congratulations, Fabio, on this excellent article, pulling together the entire ALCL experience in the European community. Please tell us, what did you find were the most important conclusions of your manuscript?
Thank you very much, Mark. Let me thank the chief editor to invite us for this presentation. And I think that the most important aspect of the paper is that we were able, for the first time, thanks to the Scientific Committee on Device Safety and Development from Europe, we were able to define the numerator, the number of cases we have at that time in Europe. So we extrapolated the European lifetime prevalence. And we were also doing an innovation in the denominator, because we were able to calculate and give the exact number of the active population. And we were very conservative, because we started from 17 years of age, not 20 as usually on papers you can find, up to 70 years of age. And we also considered the female transgender population. So those data were very reliable. And we were able to understand from our outcomes that it's extremely important the possibility to track cases, to implement the possibility of tracking cases. So we could find out that 60% of the population of the nation in Europe have done some kind of implementing for data collection, and they were able to collect 91% of the cases that at that time were in Europe. So it's extremely important, the underreporting and the unawareness of BIA-ALCL in Europe. Nevertheless, another important aspect is that Australia and the Netherlands, surprisingly, have the same very close lifetime prevalence of one case every 2,976 or 69, respectively. And this close data is probably related to the fact that both has the same kind of breast implant registry, which is an option-out implant registry.
So, you know, what I was most struck by your manuscript was how that information was critical to the SHEER committee's consensus findings on BIA-ALCL that came out just this past spring. How do you think that they used your information? What were the main findings? I know both you and I were participants on that committee. How did you think your manuscript fit in with the SHEER findings?
Well, I think that my manuscript was just what they was looking for to update the situation in Europe, to take a decision and to make especially the primary line of evidence. Because for the first time, the SHEER was able to define that there is a causal relationship between the texture surface of breast implant and the BIA-ALCL. They completely take out the smooth implant, which are not responsible at all. And so those data could help to demonstrate the primary line of evidence based on the epidemiological results. So my epidemiology joined other papers on the epidemiology aspect, and they could find out that there is a causal relation, which is extremely important. Those causal relations, nevertheless, it's of a moderate weight of evidence. Moderate because the first line of evidence, which is the epidemiological one, is fully demonstrated. Second line of evidence, which mainly are mechanistic type of line of evidence, like the etiopathogenesis, it's almost completely known, but not completely, because we know the pathogenesis, but we don't know the etiology, which is probably between the four more known possibility, which is the biofilm theory, the tribology theory, or the microparticulate, and the last one are some toxic compound that can be included in the implant.
Well, as SHEER noted, this manuscript was another important piece of evidence in establishing that causal relationship between textured implants and ALCL. again, congratulations on this paper. And for the readers, if you'd like more information on this, both Fabio and myself invite you to attend the third World Consensus Conference on BIA-ALCL in Rome, Italy. That'll be October 8th and 9th. It'll be combined with the 7th International Breast Surgery Workshop. If you can't attend in person, please join virtually. We hope you will attend. Thank you, Fabio. And again, congratulations.
Yes, sure. Let me add one only issue is that in 10 months in Europe, the lifetime prevalence has moved from 420 to 478. So it's still going on actively, the BIA-ALCL count. So we wait for you at the meeting to have the latest update. Thank you.
Thank you.